Today, we're talking about a high-tech treatment that is a non-invasive treatment for brain tumors. It really sounds like something out of the future, but it's here right now. Even though you might think, well, I don't have any interest in this, you never know what the future holds. So, if you want to know more about this new treatment, please stay tuned. Hey, good morning, everyone, and welcome to SCAN FYI. Yeah, today we're talking about something that feels like it's way in the future, but it's here right now. And my guest today is Dr. Shabbar Danish. He is the Chair of Neurosurgery at Jersey Shore University Medical Center in Neptune. Good morning, Doctor.
Good morning. How are you? Thank you for having me this morning.
Oh, really? I'm so happy to have you with us today. And let me also mention that the sponsor of today's segment is, coincidentally, Hackensack Meridian Health. So perfect. So please introduce yourself a little bit for our audience and tell us a little bit about your particular interest in this.
Good morning, everybody. Thanks for taking a few minutes out. My name is Dr. Shabbar Danish, and I'm the Chair of Neurosurgery for Hackensack South and Jersey Shore University Medical Center. As a chair of neurosurgery, I have a lot of different things that fall under my umbrella, but my particular clinical interests over my career happen to be minimally invasive and non-invasive solutions to treat difficult diseases, which includes things like brain tumors, but also includes things like facial pain, vascular malformations, and movement disorders. And so in the context of that clinical interest and my own scientific interest in the things that I work on, regionally and nationally and around the world, I've helped to bring programs here to make those treatments available for patients.
So I think people who live in the greater Ocean County area, Monmouth Ocean County area, which is mainly what we serve at SCAN, you should be thrilled to know that this type of treatment is available locally.
Absolutely. I think, one of my biggest goals in my own career in New Jersey is to make sure that, especially in a place like the Northeast United States, there's absolutely no reason to travel long and unheard of distances for good care. In fact, I've spent over a decade collecting extremely well-trained physicians, putting together teams of professionals that can offer the, highest level of care. And I think, with respect to what we're talking about today, which is the non-invasive technology that just, opened yesterday, actually, at the hospital, it is
Wow.
the newest form of technology that allows for non-invasive treatment for several categories of brain diseases, which includes brain tumors, and as I said, facial pain and vascular malformations. In fact, in this geography in Monmouth Ocean County, there's many people who I find who are living with facial pain and have just not had a treatment option. And so they're told by either family members, friends, doctors, well, there's nothing that can be done. So that's what we've changed. We've brought the people and the technology now that allow that work to be done non-invasively. And the machine requires no incisions, no anesthesia. You come in, you get zapped, and you go home the same day. And, I think one thing people get afraid of is that, well, just because you come in and talk to us, we're going to tie you up to a chair and force you into a treatment. And this is nothing like that. This is about getting information, and this is about meeting people and physicians and people who are part of the program who can lead you to better life, better control of symptoms, maybe even disease cure. Sometimes, we see people in this geography who have a benign brain tumor or have something that could be treated, but the message they're told is that the treatments are too dangerous or too risky and you shouldn't consider them. And in fact, all of our data suggests otherwise. You actually want to treat these things before they give you trouble. And I often tell people that, when we think about the brain and the nervous system, it's a little bit of a mystery for people. But if I was the cardiologist and we were in the cardiologist's office and I said, well, you have a block in your heart artery, you can either get the stent now or wait till after the heart attack. You'd be begging to go off to the room to get your stent.
Yes.
It's the same concept here. So now we have the tools in order to do it. And just to be a little bit more precise, the name of the machine is called the ZAP-X gyroscopic radiosurgery machine. So it's called ZAP-X radiosurgery. And radiosurgery is a term that is a technique that allows the use of highly focused radiation that delivers the dose to the target and does not allow dose to go to the normal, parts of the brain or the body. And I think, people who have a traditional understanding of radiation just have these images of losing all your hair and losing weight,
Yes,
going
absolutely.
and so this is completely different. That you don't lose. It's in many instances is a one-day treatment. You come in here, you get zapped, and you go home the same day.
Well, first of all, just using the word zap makes it sound a little crazy. But first of all, I feel like people have the fear of anything invasive in their head, which I understand. And the whole point of today is letting people realize that there is an amazing option available that is non-invasive. And the ZAP-X, is that the name of the treatment?
That is the name of the machine.
ZAP-X.
Mm-hmm.
Okay, ZAP-X, ZAP-X. Yep. It sounds very Star Trek, but it's happening right now.
It is, and it's the machine is an amazing advance of the technology, and I think what we really want people to understand is that the health system and my program has made such a massive commitment to making sure that the most leading edge technologies are available here. So in addition to the ZAP-X, it is paired with a machine called the Synaptive MRI. Now, I don't know if you've ever had an MRI yourself, but you sit in the coil, it makes these clunking noises. You're there for 30 minutes, then the tech says, oh my God, you moved, I have to do it again. So these things ended up being real hurdles for patients. So when I put this program together, I said, I want to make that part better for patients. So what we did next to the ZAP-X machine, because these machines always require imaging. It's an image-guided procedure. But getting the imaging was always such a difficult part for patients and families. So we got a head only, an MRI that is specialized in imaging the brain only. It is silent. There's no clunking.
Wow.
And what used to take an hour can now be imaged in 15 minutes. And we can then take those images, create a plan and a treatment within a day or two. Whereas in the past, or anywhere else you go, it'll take you a week to 3 weeks. And if you imagine if you have something you need treated in your head, you want to treat it right away. You don't want to wait 2 to 3 weeks. So that's what we're going to be able to accomplish with this new program and these new machines.
Other than a brain tumor situation, you were talking about facial pain.
Correct.
Can you explain what does that mean exactly?
So I think specifically there's facial pain comes in many forms, and there's many reasons why people get pain. One of those diseases is called trigeminal neuralgia, which is a lightning type pain that comes into the face. It can occur in people in all ages, usually in the young adulthood or older adulthood, and it is a terrifying pain syndrome. It has no warning. It keeps people from eating, and it's one of these pain syndromes that actually has a fairly high suicide rate because it destroys people's lives. Wow. And there's 1 or 2 or 3 medicines that work, but once those medicines don't work or they give you side effects, people don't have good solutions. And I found after coming into this geography, I found there's many people who are just told by their friends, family members, physicians, that nothing can be done and you should not consider an operation because it's too risky. Now, the operation I'm going to leave out of this because the operation is not that risky and it's right for some people. But the ZAP-X machine can actually treat that pain non-invasively. No incision, no anesthesia, no hospital stay. You come in, you get zapped, and the treatment blunts the nerve so it doesn't send pain to the face anymore. And it can allow people to live symptom-free.
So the one of the things about this that for me is very miraculous. I know for a lot of people who have to undergo radiation, part of the thing, not, in addition to losing your hair, etc., is just that it's sort of scattering throughout your body.
Not true.
And it's affecting
Not
other
true with
organs.
this machine. Not
well,
true
that's
with this
right. That's the point. It's such a pinpoint accuracy.
Correct. So if
You're
you
not,
go get,
you're
yeah,
not
so if you,
hurting.
yeah, so if you go get radiation on a standard radiation machine, that statement is true. So if you're treating your face, you have radiation scattered to your thyroid gland, to your breast, to your belly, and you worry that down the line am I getting radiation-induced cancers or malignancies? But this next evolution of technology has reduced the radiation exposure to the rest of the body by like 99.7%. So it's only getting radiation where you absolutely need it. And even a centimeter away in the brain, you're getting no radiation.
So that alone, I mean, that's just unbelievable in the most wonderful possible way. Because I know that is a fear for some people, getting radiation where you don't need it. But this has such pinpoint accuracy.
And the other thing here is that this machine is truly pioneering. The MRI is the only one in the country. The first one in the country is here at Jersey Shore.
No kidding.
The ZAP-X machine is only the fourth in the country. So it is here and available for treatment before any of the big name places that you see on billboards.
So is it, do you feel, obviously you are on the forefront of all of this technology, Dr. Danish, but other doctors, I wonder if they're even aware of all of this, which makes it even more important that people watch this video so that they're aware of this treatment right here locally.
Well, awareness and education and like we said in the beginning of this segment, happens in many different ways. Happens through collegial interactions, scientific interactions like this, multiple conversations, because in every field, medicine included, it just changes so fast. So it's impossible to always keep up with all the changes unless you're really right in the middle of it, which is why it's important to continue doing things like this so that the information, because you never know how the information gets out. And it's just important to talk. It's important to keep an open mind and not have preconceived notions and understand that, the world is constantly changing.
And that's a good thing when it comes to medicine. This is a change really for the better. Do you foresee that, well, now is this basically being used for in the head for brain tumor?
Specialized for the brain. Correct.
Okay, but I'm guessing going down the road, it will be used for many other things as well.
I mean, there are other machines and other technologies that specialize in other body parts, but for, under my, sort of, what's important to me is the brain and spine and the, anywhere in the body there's nerves. So right now this program is concentrating on diseases in the brain. And, if you have a machine that is specialized and built for a specific body organ, why would you use a different machine that's not? It makes no sense.
Absolutely. So for someone who's watching this and they don't, what might you have to be very aware of to realize that maybe you do have a brain tumor, maybe there is something going on where you need to see a doctor?
It's so hard to tell. Nowadays, people get tests and images for all sorts of reasons. Nowadays, if you go to your primary care doctor and say, I have bad headaches, the medical atmosphere has changed so much that nobody's saying, hey, why don't you drink a little caffeine? Everybody says, well, go get an MRI of your brain. So we're seeing pictures for all sorts of reasons. I think if you get a picture that shows something that says, oh, there might be a tumor or there might be a blood vessel tangle or this or that, come see us, come talk to us and we'll put it in context and, make sure that, we give you good advice.
Well, I want to say to everyone out there listening, honestly, I hope you never need the services of Dr. Danish. However, if you ever do, you're going to be so happy that all of this is available to you right here in Ocean County, which I just think that's the greatest.
Yeah. It's really leading edge stuff and it's available like
right
I said,
here.
It's only the fourth in the country and it's available here.
That is pretty sensational for us. It really is. Dr. Danish, I am so appreciative of you being here today. We're going to put all of the contact information out there in case people need to reach you for any kind of a consultation. We're very lucky here down to have someone like you in Ocean County. Thank you for being with me today. I appreciate it.
Thank you for all your time.
All right. Well, remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on SCAN FYI. Bye, everyone, and bye, Dr. Danish.